Welcome to Plastical Review. Let's go through the latest papers on aesthetic plastic surgery of the face and eyelids for this month of May. So the most interesting paper is a study by Andrew Giacono and Melanie Malone on ASJ. It's a study on the retaining ligaments of the neck and its implications for subplatysmal facelid surgery. So what they actually did is that they studied 10 fresh cadavers, which meant 20 hemifaces, and they tried to define the width of the cervical retaining ligament from the mandibular border all the way down to the cricoid cartilage. They found out that this width was mean of 15 millimeters, and it ranged from a thicker width in the mandibular region of around 17 millimeters to only 12 millimeters around the cricoid cartilage. And what do the authors say that could be the implications for facial rejuvenation surgery around the neck? Well, they say that if this ligament is completely released, you can have a lot more pull laterally on your platysma and neck tightening, and this may even avoid the need to perform an anterior approach. The author states that when he's able to fully release this cervical retaining ligament, that he can use the anterior approach only in 13% of the cases of his facial and neck rejuvenation procedures. And he even states that other authors, specifically he references Musto, even propose not opening the anterior neck when they perform an adequate release of this cervical retaining ligament. The commentary is very worthwhile. It is performed by James Zins from the Cleveland Clinic, and he makes specifically two comments. First of all, that although the authors state in their study that a subplatysmal dissection is very safe and it can be done without injuring the facial nerve, James Zins does comment that this may not be so at the level of the mandible, and that if not carefully done, and that there's a danger zone right at the level of the facial vessels where the mandibular branch can be injured if one extends the dissection too far out at this level. The other comment by James Innes is that despite a wide release of this cervical retaining ligament, he still believes that there's a benefit to opening the neck in most cervical rejuvenation procedures, and that, of course, that there are authors that get good results with just a lateral approach, of course, and he states surgeons such as Fogley and Tornard and Rappel and Giacono, the author of the paper, of course, that we are reviewing. And he states, of course, that other authors such as Fellman and Timothy Martin and Stuzin and himself, James Innes, that still believe that that the anterior approach is fundamental to achieving long-term and long-lasting results in cervical rejuvenation. Definitely a hot topic. I mean, there's been several papers in 2016 that have also commented on the long-term effect of cervical rejuvenation and the importance of the anterior approach. I remember Rorick's paper specifically, but several other papers, and definitely some very good commentaries on this matter by James Stuzin from papers from last year, 2016. And I think that the reason why there's some surgeons that get good results with avoiding the anterior approach is that probably the patients are different, and I think that this might be the most important issue. We cannot have a cookie cutter procedure for all necks. There are heavier, thicker necks, and there are some necks that are so thin that you can actually just pull on the side and get good and adequate results. Definitely, I think the importance of all this is that it is key to individualize the procedure for each patient. And I think that's all. That's all for aesthetic plastic surgery of the face and eyelids for this month of May 2017. I hope to see you all next month, and thank you very much.